Dr. Anthony Fauci says he's not ready to declare COVID-19 over. President Biden told 60 Minutes he considers the pandemic past. And the head of the World Health Organization says the end of the COVID-19 pandemic is near. So who's right? I'm joined right now by infectious disease expert Dr. Amish Adalja from the Johns Hopkins University Center for Health Security. Doctor, thanks so much for being with us. What say you?
I agree with the president. I do think that the acute phase of this pandemic is over because we have so many tools that we didn't have in the early days of this pandemic that range from vaccines to boosters to antivirals to monoclonal antibodies to home tests to wastewater surveillance. And what we've seen is COVID-19 be shifted to an outpatient illness, not something that is inundating hospitals the way it once could. But we have to remember that there are still hundreds of people that die every day from COVID-19. And even if it's not a pandemic, that doesn't mean it's still not an urgency to get those deaths down as low as possible.
So, Dr. Adalja, you agree with the president. You believe that the pandemic has passed. What precautions, if any, should folks be taking to make sure they stay safe and healthy?
It's important for people to use all the tools that medicine and science have given us to make this a much more manageable infection. We need high-risk people to be boosted. We need people to be prescribing Paxlovid to their high-risk patients. And we need people that are at high risk to consider wearing masks when they're in crowded, congregated areas. But this is going to increasingly be something that is managed by individual risk tolerance and individual risk factors like many other respiratory viruses. I think the fact that our hospitals are able to handle the cases that we're having really shows how far we've come from the early days of this pandemic.
And Dr. Adalja, how would you describe why so many entities are at odds over the status of the coronavirus pandemic?
To me, I think it's because people are thinking that it's all or none, that it either has to be a pandemic or it has to be nothing. But even if something is not a pandemic, doesn't mean that we don't care about it. It doesn't mean that we don't try and strive to get deaths and morbidity and mortality down as low as possible. All of our infectious diseases are not pandemics except for COVID-19, and we're still striving to drive mortality lower. So I think that there's this kind of false alternative that's been set up, that it either has to be a pandemic or it has to be nothing, and that's not the case. An endemic infectious disease like COVID-19 is still something that merits our concern. It's just not something that really fits the definition of pandemic at this late stage.
The president believes the pandemic has passed. Do you agree with him? Could we see ourselves going back at all in the future?
I do think we're going to see cases go up and down. We're going to see hotspots. We may see surges. We may see new variants appear. But it's unlikely that we see the bad old days of the pandemic return because there's so much immunity in the population from vaccines, from boosters, from prior infection. Plus, we have drugs like Paxlovid and monoclonal antibodies that are going to be able to keep patients out of the hospital, so we won't see the type of crisis that we once saw. So I think that we're going to always have COVID-19 cases. And the key thing is to make sure that people are using the tools that we have to make this an outpatient illness, make this a much more manageable illness. And I don't think that we will see those bad old days again.
Important perspective there, Dr. Amish Adalja from Johns Hopkins University. Thank you so much for joining us.
Thanks for having me.